So this is when we talking actually daily actually about the how IT can be used making these type of concept of hospitals actually. So Dr. Suri, would you like to say something on this? Today we are talking about say paperless hospitals, or we say IT-enabled hospital, or cyberspace hospitals, or virtual hospitals, and then mobile technology, like Dr. Chaudhary has raised this issue actually. So I feel that why we should scare of the cost, but on the other side, it has benefited the masses actually by having a mobile technology actually. So on one side, we have gone for automation, and then it has eliminated a lot of waste also in the hospitals actually. So what are your take on this actually?
See, in laboratory medicine, I owe
Not
a lot,
laboratory, but otherwise also actually. When we're
lot
talking
to the information technology. I think at every stage, the moment the patient lands to the time he gets report, it is all information technology. And I think same will be true for hospitals. I think hospital person will be able to tell better.
See, if we look at historically, the cost of technology has actually come down in last 10 years. I mean, I used to work in one of the finest technology companies 8 years back, and I'll just take few numbers. A 2-slice CT scanner used to cost 2.5 crore rupees those days. Today, good 16-slice costs less than 2 crores. So somewhere, I would say there has to be very clear value judgment on what we call as technology. It is upgradation equipment. So that is one side of technology. Second is using IT as an enabler to do your day-to-day work and increase the efficiency. That's where India has leapfrogged in a big way. I mean, the way our hospitals are now automated, whatever we might say, where at least a EMR, in US it is still a distant dream. There are islands of information lying and nobody can give one-line EMR. At least I would say that we have done a decent work because we didn't have any legacy systems. So principally, it is helping a lot in eliminating that waste. You think of a situation if barcoding mechanism was not implemented in labs. How many samples? I mean, 40,000 samples a day. What kind of manpower? And the consistency of quality of manpower, the challenge would have been. So I would say, well, while we be technology, there should be two views. One is a technology which is, as we say, desire. You know, I must have a 264 slice CT or I must have a 3 Tesla MR, which is fine. Second is a technology which actually helps you do day-to-day work together. Today you look at the mobile communication. I mean, 8 years back, nobody thought that a postman or a maid or somebody all will have a mobile with them. The way technology, and see, soon we should see M-Health in India. I mean, there are applications now coming, a lot of, I would say, Scandinavian countries, where, you know, they have many applications on mobile which can help patients in remote areas. So I would say technology cost is decreasing. The more effectively we use, and India is the country. Telemedicine, I mean, the way we can use, how can a surgeon reach from Delhi to Northeast, where, you know, which is a riot infested area? But if there is telemedicine, I mean, we can provide the consult. I feel very upbeat about this technology, provided we view it very, very cautiously that we are doing it to improve patient care, safety, or we are doing to just trying to improve the infrastructure. That's a decision, again, the leaders of today have to take.
No, before I open this to the questions from the audience, I'd like to share 1 or 2 points actually that I was involved in procurement of CT and MRI in Bhutan actually, first CT MRI in Bhutan. And after selecting the first lowest, and we were able to negotiate with the vendor that they'll provide free software for upgradation because they don't want you to put an engineer over there, but it's very expensive. So sitting in Bangalore, and they can monitor the parameters in Bhutan. And they were quite happy, and we were also very happy that we have not spent anything extra, and on day-to-day basis, this technology is helping us in monitoring the performance of the equipment. So another thing actually that sometimes what happens actually in government setup, especially the public sector hospitals, so there is a provision that you cannot negotiate with the second, but you can negotiate with the first lowest. So I have certain instances where the procurement was finalized for 50 crore rupees, and then we started negotiating with the first lowest. I was able to brought down by 4.5 crore rupees with the first lowest secretary. So what I want to convey that you as a administrator or the user of the technology, if you are a good negotiator, so you can get the best price actually. And maybe actually you are able to negotiate, but suppose you call a tender for 16 slice or 32 or 64 slice CT scan, and by the time you finalize, it takes in government setup about 6 months. Maybe another 128 has come actually. And the vendor, if you are a good negotiator, you can negotiate, okay, within the same price, I like to go for 128, and they are ready to give that also. So one need to be a good negotiator actually. Now I invite some of the questions from the audience, and you can point out to whom you want to have an answer, or any panelist can answer. Please.
I have one question, sir. The IT field, and IT, as everybody knows, every 6 months, maybe 1 year, the price halves, the performance doubles. Increasingly, more and more of innovation is done via IT. Now, while in the US there's intense competition and everybody's got to be cutting edge and all this stuff, and they pay for it. In India, we have this anomaly that we are a poor country on one end. Yes, we got islands of excellence. But at the end of the day, if you're talking about healthcare, you've got to keep the nation healthy. That means each and every one. We just can't ignore him just because he can't afford to pay it. He can't get a 512K slice, whatever it is, and somebody can afford it, he gets it. So we have to definitely have a different business model for that. So we are two situations, fortunately. We don't have to be in the bleeding edge of technology. If you are about, say, 2 steps behind, you can pick up technology very cheap, because that chap wants to get rid of it, one. Second thing is, if we do standardization, today everybody takes cell phones and internet, it's de facto. I got into this field about a couple of decades back, when you had Ethernet, ArcNet, and you had umpteen number of nets, and these nets couldn't talk to each other. Today we're having the same situation in IT. When we're having these various EMRs which are going to be coming about and all that, we should not, let's learn from the mistakes of the Americans, we should not accept each and every one of them. Standardize on 1 or 2, hopefully open source. Why open source? Open source when you don't pay license fees, etc., is because you have the source. Our core competence does not lie in designing healthcare information system, despite whatever we say. Vista, I know something about that, and I'm sure there are other better products also. They have been designed and they've evolved over 20, 30 years. That kind of knowledge, that kind of rules and logic, it would be very difficult to program. So why don't we, from a national point of view again, standardize on 1 or 2, maybe set up a panel, get IT people involved, get the doctors involved, and say, listen, for India, we're standardizing on these 3. It has 2 advantages. One is, in case it's open source, you don't pay for the license fee, etc. In case even if it's proprietary, you can beat on the vendor in terms of cost. You buy more numbers, cost comes down. Similarly, for all medical equipment, if we really, right now, what is the cost of the equipment manufacturer? His selling cost is so high. Tenders, and each tender he might buy 3 machines, somebody else throws another tender, another 3 machines, tender opening, going, closing, etc. If you can consolidate all of this thing, then you can float 1 tender and you can buy job, you can twist the chap's arms. So I think the government, okay, let's leave the government out for 2 simple reasons. We know the government should do all of this thing. We also know what the current government is capable of doing. We can't wish it away, that's something we have to live with. But I think all of us are reasonably intelligent people. Can we not get together? Everybody is going to save money. Similarly, let's say, as the gentleman from Path Lab was talking about, IT is a core thing for the Path Lab business. Now, they have 4 people who own the Path Lab business. Instead of each of you designing a separate IT system for collection, for ERP, for transduction, for talking to the EMR, etc., why can't we standardize on a common? To give you an idea, in Detroit, about a decade back, you had Ford, you had Chrysler, you had General Motors. And they were getting supplies from common suppliers. A lot of them were common. Crankshafts to come from one place, whatever it is. And all of them had their own separate systems. So they all got together. They're competitors. And mind you, purchasing is not something which you like to give away. It's a very sensitive thing. You give your purchases, the competitor knows and all this. But they were able to agree that let's have a common bidding system. So they designed a system called Covisint, which used the latest e-commerce things which was available 10 years back, which was much way ahead of their time, if they might be commonplace. So I think we should be forming something like that. So we start collaborating. We keep competing, but we also start collaborating. This will bring down the costs. And at the end of the day, don't forget, if you think you're going to make money in the Indian market, there's much more money to be made in medical tourism. So why not bring down our costs, standardize it, increase our capacity, and get the Yanks in. Thanks.
Thank you for your comments, sir. Actually, I agree with you. Even about a week back, there was a meeting in Taj Mansingh of Global Association of Physicians of Indian Origin, which was being addressed by Mr. Dinesh Dwivedi. Mr. Dwivedi. He says that why don't you learn from the cardiologist, which they do bypass. So why you are dependent on the government always actually? So you have to find out some ways so that how we can join together and we need not to depend on the government for each and everything actually. I think I totally agree with that actually. Any comments from you, sir?
Yeah, I think completely agree with you. There are just two dimensions of it. One, I think we are all accountable to stakeholders. And stakeholders want the best return for their investment. Sometimes that can only be done by being different and better. But having said that, while you can be different and better, you need not be foolish. So we need to stay close. But then we also need to put ourselves in the shoes of, let's say, all the radiology companies in Delhi come together, Uma and everybody says, all right, I'm going to do my buying together. But what prevents Siemens, GE and Philips from also coming together and saying that, so you can have a buyer cartel and you can have a supplier cartel. I think market is a very powerful thing. The most powerful system in the world is the market reality. We all know where to put our money. So in a sense, I think let's believe in the wisdom of the market, that only good stuff will survive. But I think we need to come together to compare notes. I mean, I have to say that Dr. Om Manchanda did a phenomenal thing trying to bring all the pathology companies together to form an association. And the best is still to come. Out of 100,000, only 7 have agreed so far to come together. So I think there's a real challenge at hand.
If I may add to what Sanjeev just mentioned, I have worked in many industries. This is my 5th industry I'm working. And my sense is these kind of things tend to happen, either the greed brings you together or the fear of losing brings you together. I think somewhere healthcare is lying in the middle. As the investments are flowing into this space and investors are going to really sitting on our head and asking for returns, I think some sense will prevail. As he rightly said, market forces will take over. And that's where some sanity will prevail. Do we need to invest in those areas where we probably can co-opt? At one level we compete, another level we collaborate. And to add to this, and I've seen this pharmaceutical industries, one manufacturing plant may be manufacturing medicines for 10 different people who are competing in the marketplace. I've seen a Hindustan Lever where same factory is producing oils, a branded oil for a company which is competing in the marketplace. You just don't, one company actually operating in 2 different places. So I think that's likely to happen sooner than later. My sense is it will actually probably happen in 4 to 5 years from now.